Assalamualaikum and welcome to our video on the topic of ergonomic and psychosocial hazards. We are students from the Faculty of Applied Science. My name is Siti Natijah Afnan binti Hamzan.
I am Nuraini Madiha binti Sahih.
My name is Umar Ahmad Shahadrian.
I am Darina Sufia binti Muhammad Salih.
And my name is Nur Shahidatun Najwa binti Safian.
And we will be your presenters for the duration of this video. The first question we must ask is, what is a hazard? Hazard is defined as a source or a situation with a potential for harm in terms of human injury or ill health, damage to property, damage to environment, or a combination of these. Ergonomic hazards. In simple terms, ergonomic means designing the workplace and tasks to fit the capabilities of the working population. Ergonomic hazards, on the other hand, describes a single or multiple physical factors within the environment that harms the musculoskeletal system, such as repetitive movement, manual handling, workplace job or task design, uncomfortable workstation height, and poor body positioning. Ergonomic injuries are also known as musculoskeletal disorder (MSD) or soft tissue injuries. These injuries include disorders of the muscles, nerves, tendons, ligaments, joints, cartilage, blood vessels, or spinal discs. Musculoskeletal disorders (MSD) are a class of illness that is the result of months or years of overuse of human joints and connective tissues that they become sore and sometimes unusable. A few major ergonomic risk factors include awkward posture, forceful exertions, and repetitive motion. A few major ergonomic risk factors include awkward posture, forceful exertions, and repetitive motion.
Awkward posture can be experienced by repeated or prolonged reaching, twisting, bending, working overhead, kneeling, squatting, and holding fixed position or pinched grips. Joints can absorb force more easily than other parts of the body, which can lead to increased susceptibility of injuries to joints, which would reduce or completely block blood flow. Awkward posture is caused by poorly designed or arranged workstations, tools, and equipment. On the screen are graphics of forceful exertions. Force is the amount of muscular effort expended to perform work like gripping, pinching, pushing, pulling, and lifting objects. Therefore, increasing these forces requires additional muscle exertions and places greater loads on joints and connective tissues, the effect of which cause fatigue and may contribute to musculoskeletal problem with not enough rest, which will put high pressure on the muscle. The last one is repetitive motion. Repetitive motion is when the same types of motions are performed over and over again using the same muscles, tendons, or joints. Increasing these forces requires additional muscle exertions and places greater loads on joints and connective tissues. The pace of work may be controlled by the employee performing the task, machines, other employees, or administrative procedures. The effect of repetitive motion can lead to the carpal tunnel syndrome, bursitis, tendonitis, epicondylitis, ganglion cyst, tendon synovitis, and trigger finger. So, what are the health risks of working on a computer frequently? The answer is computer vision syndrome. Computer vision syndrome, which describes a group of eye and vision-related problems that result from prolonged computer, tablet, e-reader, and cell phone use. These are the symptoms of prolonged computer use. The first one is dry eyes. A person blinks 66% less when on the computer. Less blinking means less tears on our eyes to evaporate, which may lead to blurred vision. The second one is carpal tunnel syndrome. It can be attributed to a wrong mouse and keyboard setup, which can cause pain, numbness, and tingling in the arms and hands. The last one is blurred vision. It can be caused by looking at a screen that's too bright, sitting too close to the monitor, and not taking adequate breaks.
On screen is the correct way to place a computer. The computer must be at eye level to prevent neck and back pain, and the computer must be at arm's length from the body to prevent computer vision syndrome. The proper keyboard placement is shown on screen. The keyboard must be placed below elbow level so the arms can rest comfortably. The arms must be placed at the sides as close as reasonably possible. The elbows should be bent at around 90 degrees. Now onto the correct mouse placement. The mouse should be at a 90-degree angle on the arm and the wrist should not be straining or uncomfortable when using the mouse. Psychosocial hazard. A psychosocial hazard is defined as any occupational hazard related to the way work is designed, organized, and managed, as well as the economic and social contexts of work. Psychosocial hazards include but aren't limited to stress, violence, and other workplace stressors. Examples of psychosocial hazards include body stressing, bullying in the workplace, or work-related mental stress. Body stressing is a collective term covering a broad range of health problems associated with repetitive and strenuous work and refers to a state of tension that occurs when we overload our bodies. Body stressing may be caused by psychosocial aspects of work. Second is biomechanical, soft tissue damage which may occur through direct exposure such as blunt trauma or sudden overload leading to a muscle tear or sprain, or indirect exposure such as repeated light loading leading to symptoms that may accumulate to cause further degeneration and injury. And lastly, individual worker characteristics. Signs of body stress include muscular pain, sore joints, tingling, burning, inflammation and cramp, loss of grip strength, reduced mobility, feeling overwhelmed at work, lack of concentration, not being able to complete tasks, regular feelings of fatigue, sleep disturbance, stress and pain affecting mood, work, family, and social life.
Typical body stressing injuries include sprains and strains of muscles, ligaments and tendons, back injuries, joint and bone injuries or degeneration, nerve injuries or compression or chronic pain. On screen is an infographic of how stress affects the body. Difficulty concentrating, anxiety, depression, irritability, mood, mind fog, higher cholesterol, high blood pressure, increased risk of heart attack and stroke. Hair loss, dull or brittle hair, brittle nails, dry skin, acne, delayed tissue repair, increased inflammation, tension, aches and pains, muscle tightness, decreased immune function, lowered immune defenses, increased risk of becoming ill, increase in recovery time, nutrient absorption, diarrhea, constipation, indigestion, bloating, pain and discomfort, decreased hormone production, decrease in libido, increase in PMS symptoms. Apart from body stressing, we have workplace bullying, which has been identified as an important risk and hazard. Bullying can occur in written communication, phones, emails, and face-to-face. Workplace bullying behaviors include abusive, insulting, or offensive language or commands, aggressive and intimidating conduct, being humiliated in front of colleagues, your views and opinions being ignored, blame for problems caused by others. Consequently, the effects of workplace bullying are stress, anxiety, or sleep disturbance, mental health issues such as depression, reduced quality of family and home life, increased absenteeism and staff turnover, reduced work performance. Solutions for workplace bullying consist of evaluating the situation objectively to see if the situation is bullying, to realize every employer has a responsibility to provide a safe work environment, be aware of your workplace bullying, familiarize yourself with the reporting procedure and follow your workplace procedure for reporting bullying, and to maintain a healthy and balanced lifestyle outside of work to help you cope with the madness at work.
To find out if you are negatively impacting your coworkers, ask yourself these questions. Do you gossip about your coworkers? Do you joke about your coworkers? Do you exclude coworkers from activities? Do you listen in on coworkers' conversations? And do you single out coworkers who can keep up? The last psychosocial hazard we will discuss is work-related mental stress, which is defined as the adverse reaction experienced by workers when workplace demands and responsibilities are greater than the worker can comfortably manage or are beyond the worker's capabilities. Major work-related stress include organization culture, bad management practices, job content and demands, physical work environment, relationship at work, and trauma. This infographic shows that 63% of workers are somewhat stressed, 7% of workers are very stressed, 27% of workers are not too stressed, 3% of workers are not at all stressed, 1% of workers don't know. Causes of mental stress include long hours, heavy workload, lack of equipment, tight deadlines, and discrimination. Among the risks of mental stress are poor worker health, both physical and psychological, breakdown of individual and team relationships, poor morale and erosion of worker loyalty and commitment, reduced efficiency, productivity, and profitability, poor public image and reputation. Here are some ways to prevent mental stress. First, having a senior management commitment to a reduction in workplace stress, consulting with workers to create and promote a mentally healthy workplace culture, use validated risk assessment processes, ensuring the organization has appropriate policies and procedures in place and workers are aware of this. This is the end of our video. Thank you for watching. Don't forget to fill in the feedback form we have provided. We will appreciate it very much. Thank you.